Hi, my name is Caitlin Richards and I'll be performing a head to toe full body assessment. First, I'm going to perform hand hygiene by washing my hands. Washing my hands for at least 15 to 20 seconds. Getting in between the fingers and underneath each fingernail. I'm going to provide privacy for my patient. Hi, how are you today?
Good, how are you?
Good, I'm Caitlin, I'll be your nurse. Can I have your name and date of birth, please?
Nicole Pellegrino, 7/12/80.
Perfect. And can you tell me why you're here today?
Physical assessment,
And what time is your appointment at?
1:30.
Perfect, we're just running a few minutes behind, I hope you don't mind. Okay. If you could just stand up for me, we're gonna walk over to the scale so I can get your height and weight. And while you're walking, could you walk on your tippy toes for me? Perfect, and your heels? Okay, and heel to toe, please. Assessing for gait, and her gait was correct. You just kick your shoes off for me and hop on that scale. Okay, and could you just turn around for me? Great. Okay, you can step off for me. You just put your shoes back on. And the patient's weight was 134 pounds and 158.5 centimeters, which equals a BMI of 24.5. Next, I'm going to take the patient's waist circumference. Just lift your arms for me. And it is 70 centimeters. All right, just going to have you walk back over to the bed and just stop at the bed for me. Great, patient is alert and oriented ×4. Okay. I'm going to have you close your eyes and just stand straight for me. Testing for Romberg's. Perfect. Okay. You just bend down as far as you can. Inspect the patient's spine for any abnormalities, lordosis, kyphosis, or scoliosis. Patient's spine is intact and aligned. You can just stand back up for me. And patient's hips are aligned and symmetrical. Can you just kick your left foot out for me and rotate your ankle? Perfect. And the other leg? Excellent. Can you rotate your arms for me in a big circle? Great. And bend at the elbows. And rotate your wrists. Great. Okay. Can you have a seat, and I'm gonna inspect your other reflexes. Okay. Raise your shoulders for me. Perfect. Okay, stick your arms straight out and push down on my arms. Great. Turn them over and push up on my arms. Okay. Lift up this leg. Great. And this one. Okay. And pull back. Great. And push forward. Okay. And pull back and push forward. Okay. And also lift up your feet. Okay. And push down. Great. Because I touched the patient's feet, I'm going to perform hand hygiene. Okay. All right. I'm going to inspect the patient's head, looking for any lumps, bumps, bruises, lesions, or infestations. Next I'm going to palpate, feeling for any bumps, any abnormalities. Everything looks within normal limits. Feel her skin is warm to the touch. It is well hydrated, not dry. Now I'm going to inspect her ears. I'm going to inspect her pinna, checking for any lumps or lesions. I don't see anything. Going to look inside the ear for drainage. I don't see any. If I had an otoscope, I would pull the ear up and back, inspecting the tympanic membrane to look for a pearly gray. And also the other ear, inspecting for the same. Does anything hurt?
No.
No? Okay, great. Pulling, backing up, inspecting the tympanic membrane. If I had an otoscope, checking for drainage. Everything looks great. Okay. I'm going to assess the 6 ocular nerves. You could just look at my pen for me without moving your head. Follow my pen. Great. And look at my pen. And that's checking for accommodation, making sure that her pupils constricted when I went forward and dilated when I moved my eye pen back. Now I'm going to inspect her pupils. Her sclera looks nice and white. Her conjunctiva in both eyes are within normal limits. They're not overly red. They're nice and pink. Her eyebrows, her nose, her mouth are, her nose and her mouth are midline. Her ears, her eyebrows, and her eyes are symmetrical. I'm checking for skin turgor. Her skin tense and goes back. That's great. Okay, if you could just look up for me, I'm going to inspect your nostrils. They are clear, free from any drainage or secretions. If you could just cover one nostril and blow out for me. Great, and the other side. Great, that is checking for a deviated septum. Okay, if you could open up your mouth for me. Her lips look pink and moist. Her hard and soft palate is moist and pink. There are no lesions. Her tongue, her mucus burcosa is clear and moist. All her teeth are intact. You could just stick your tongue out for me. Wiggle it back and forth. Say ah.
Ah.
Perfect. Okay. All right. Let's see. If you could smile for me and frown and wrinkle your forehead and puff out your cheeks. Perfect. Okay. Just let me see your hands. I'm just going to check your. This is checking for a capillary refill. Checking to make sure that the circulation comes back within 3 seconds. Perfect. Okay. You just squeeze my fingers for me. Great. All right. Now I'm going to inspect your anterior thorax. Skin is within normal limits. I don't see any bumps, bruises, any cuts. Okay. I'm going to feel for any masses or lumps in the intercostal space. Great. I'm sorry, and I'm gonna palpate. Percuss. Great, okay. I'm going to feel the pre-auricle glands, post-auricle glands, submaxillary, her throat, her thorax, her thyroid. Looks Great. Can you swallow for me? Okay, and her subclavicular. Okay, great. Now I'm going to listen for lung sounds. Just take a deep breath for me. A deep breath. Right, deep breath. Deep breath. Deep breath. Deep breath. And deep breath. And one more. Great. Okay. Lungs sound clear. She has strong breath. There is no presence of rhonchi, wheezing, rales, or crackles. Next, I'm going to assess the posterior thorax. The skin is within normal limits. No lumps, bumps, bruises, cuts. I am going to palpate for any bumps. Okay, everything feels fine. I'm going to percuss. Okay. If you could just take a deep breath for me. Perfect. That was checking for tactile firmitis to make sure that her lungs expanded and her lungs expanded within normal limits. Okay, could you just say 99 for me?
99, 99, 99.
Perfect. And as I moved my hands down, the vibrations diminished. And I'm going to auscultate posterior thorax. Just take a deep breath. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Great. Posterior sounded clear, not diminished, and free from any crackles, rhonchi, wheezing, or rales. Okay. I'm gonna have you take your socks and shoes off and lay back in the bed for me. Thanks. Now I'm going to check for the cardiac. I'm going to listen. Okay. Second intercostal space, listening to the aorta. The left intercostal space, second intercostal space on the left side, the pulmonic. And the third intercostal space on the left side, Erb's point. Okay. The fourth intercostal space, the tricuspid. And the fifth intercostal space, the bicuspid. And at this point, I would listen for a full minute, assessing the apical pulse. Heart sounds great. At this point, I would turn my diaphragm around to the bell side and listen at all five points again. And listening with the bell would assess for any heart murmurs. The aorta, pulmonic, Erb's point, tricuspid, and bicuspid. Great. Okay. I'm just going to have you turn your head to the right for me. This is checking for jugular vein distension. I'm also going to feel for the carotid artery. Pulse is nice and strong. You turn the other side for me. No jugular vein distension. Assessing the carotid artery on the right side. Pulse is nice and strong. Equally strong on both sides. I don't want to do it at the same time because you would cut off the circulation to the head. I'm going to check the temporal pulse. Okay. Also, I'm going to auscultate for any bruits in the carotid artery. Turn your head to the left. And the other side. Pulse sounds strong. No bruits present. Okay. I'm going to lay your bed flat. Do a full abdominal assessment. Thanks for lifting your shirt up. I appreciate that. All right, I'm going to inspect the abdomen first. The abdomen is slightly rounded, nice and flat, no visible bumps or cuts or bruising. Next, I'm going to auscultate. I'm going to start in the right lower quadrant where the bowel sounds are most active, listening for 5 to 35 bowel sounds in a minute. Bowel sounds are present there. And they're present there. Nice active bowel sounds. Have you had any nausea, vomiting, diarrhea?
No.
No, any dizziness, any fainting spells?
No.
Great. I palpate lightly. Any discomfort?
No.
No. Checking for any masses or lumps. Okay, I'm just going to palpate a little bit harder. Okay, tell me if it hurts.
No.
Okay. Sorry,
Whatever that
sometimes
was.
Stomach muscle. Great. The abdomen is free from any lumps or masses. Right. Pull your shirt down. I'm going to check for edema. Okay. Okay, no visible edema on that leg. And no visible edema on that leg. Okay. I'm going to check her brachial pulses.
You gotta zoom in, Julie.
Oh, there we go. They're bilaterally strong. I'm going to check her radial pulses. Also bilaterally strong. Okay. I'm going to check her posterior tibial pulse. both laterally strong, and the pedal pulses. Both laterally strong as well. Next, I'm going to assess for capillary refill in all 10 toes. And capillary refill is within normal limits. They fill back up with less than 3 seconds. Okay. I'm going to check for plantar reflex. Okay. Okay. And perfect. Okay, and I'm going to perform hand hygiene. Okay. Think. I'm just gonna have you sit up for me, just in case I miss anything. Okay, I'm just gonna have you step off the bed. Okay. I'm just gonna take a look at your fingers one more time. And I'm assessing for any clubbing, and I don't see any clubbing at the ends of her fingers. They would look bulbs and square at the end. And no clubbing in the toes either. I think you're gonna be good to go for your physical assessment. I'll have the doctor write that up for you, okay?
Thank you.
All right, thank you. Have a great day. That concludes my assessment.